Welcome back, ladies and gentlemen. We are at 40 minutes past 8 a.m., which means that we still have about an hour to go, and this hour will be full of information, entertainment, and everything that is Art and Culture Monday. So we are here for our second launch, and I'm not alone. I am joined by a gentleman that we are going to be having a conversation with, and also his counterpart will be joining us via Zoom. So shortly we are going to be having Rita on Zoom, and we're going to be having this conversation, the three of us, and disseminating what it is that we are talking about. But right about now, I just want Emmanuel to say hello, tell us where you are, what you do, why you are here, and then we jump right in.
I'm Emmanuel Lee.
Yes.
I support communications at the Center for the Study of Adolescents, which in short is CSA Kenya.
Yes.
And we basically work to improve and impact the reproductive health and rights sector of young people, and also including adolescents, to just make sure their reproductive health and rights are realized and upheld.
Yes. Yeah. Amazing. How important, because I think we have had this conversation over and over again, and we are still having it. How important is the discussion on reproductive health? Who does it touch on most, or who does it affect most? And why is it important for you to even have a whole organization basically discussing matters reproductive health?
I mean, sexual reproductive health and rights affects everyone.
Yes.
It doesn't matter the demographic, it doesn't matter the age, whether you're young, whether you're old, whether you're just middle-aged, you definitely have sexual reproductive health and rights needs. But specifically for young people, there has been a rising gap in their needs and meeting their needs. And this is because, also with the time and how the time has been changing, the demographic has also been changing and the culture has been changing.
Yes.
So to mean young people now are more exposed. Young people are now practicing on certain activities that maybe our parents didn't even get to think about. And so this means young people are exposed to so many risks, before they even get to school or even to advance to tertiary institutions. And also for the disadvantaged young people, and here we're talking about adolescent girls and young women who are just also trying to get menstrual hygiene products. That is also a reproductive health issue.
Yes.
So when we speak of reproductive health, it doesn't necessarily just fall under sexuality, but it's a whole spectrum where it affects just the health, access to service, and also information and level of awareness.
Exactly. So times are changing, and so we are having this conversation in order to change with the times to meet the needs that are as of right now. Amazing. We have Rita via Zoom. Rita, can you hear us? Rita?
Can you hear me?
I want you to say hello.
Yes, can you hear me?
Yes, we can hear you clearly. Amazing. Please say hello, tell us who you are, what you do, and then we will dive right into this conversation.
Okay, hello. My name is Rita Anindo Obonyo. I'm the Youth Project Coordinator Reproductive.
All right, that is Rita joining us via Zoom. We are trying to get our connection vizuri, Rita. Your network is a bit, we are waiting for you to sort that in a little bit, and then we're going to be going on with this conversation. But luckily, Emmanuel is here to help us, where we can, before we get Rita right. And how did you come to work with Rita? Let's start there.
I mean, this is definitely a small and a big space at the same time.
Yeah.
We've started out as youth advocates, as champions. Here is where basically we're volunteering our time to just make sure our fellow young people are impacted, and also gets to be informed, also gets to be aware of what reproductive health means, and what it it represents in their lives, so that they can be able to identify their needs and be able to cater for them. So with that journey with Rita, all that time, I mean, it has been around 5-6 years now. And I mean, now we're literally in the system, and we're trying now to pull up our influences, pull up our skills and all our capacities and networks to just make sure that young people are meaningfully engaged, young people are meaningfully involved, and also at the end of the day, they are also impacted positively, and they are the direct beneficiaries of what we are trying to achieve, which is a healthy nation.
Yes, amazing. I'm being notified Rita has joined us. Rita, you can hear us well? Yes, Rita?
Can hear you well.
Yes, amazing. Perfect, thank you. Emmanuel was just telling us how you started out, and it's been quite the journey. It's 5-6 years is a long time. So Rita, where are you involved right now, and what exactly are you working on?
Currently, right now, as I had mentioned, I work for Reproductive Health Network Kenya, and we have a scientific conference that is happening in June, and we are calling out on young people to participate in this conference. Just a bit of a background. When we look at the statistics, Kenyan statistics of young people, we have more than 75% of young people, of people below 35 constituting of young people. This is problematic. This is an opportunity to be problematic because in this population there isn't 15% of the of the adolescents and young people are people who have got pregnant, and 12% constitute of live births, and 1% constitute of those who got a miscarriage, or it could be an unsafe abortion. This statistics is worrying, having our current population, and this statistics really shows that if we continue with the current trend, then we cannot harness from our demographic dividend. And what do I mean with this? It impacts the quality of life. Imagine that girl who got pregnant at the age of 14, that girl who is 22 and she has 2 children. What does this mean for the quality of life of this child? Another thing that is also a concern is also the economic growth. While we focus on the numbers, these numbers impact on our economic growth and on our outcomes of economy. Right now, we are struggling with inflation, where a lot of people cannot even afford unga. Imagine if we have a country where HIV new infections are high among adolescents, teenage pregnancies are high among adolescents. We also have unsafe abortions happening among this cohort. What does that mean? It is going to be worse. And that is why we cannot healthcare as healthcare alone. We need to look at healthcare and how it relates to other aspects of our country's development, including economic development, climate change, gender, and other issues. So that is where we are, and we are saying we are providing a platform where young people can be meaningfully engaged. We have a lot of interventions happening in this country. A lot of NGOs go to Korogosho, go to Kibra, go to Madare, go to Mukuru, go to rural areas. A lot of things are being done. But again, what is the gap? Why are teenage HIV new infections? Why are we not reducing mental health issues among adolescents and young people? It is because young people are not meaningfully engaged in programs, and it means that the programs are not informed and they are not human-centered. It's people who are coming together and doing their own interventions, assuming that this works for the young people. So that's it from me.
Yes, amazing. Thank you, Rita, for being here and for expounding on that. And Emmanuel, this was actually my next question, because I took note of the meaningful youth participation. Does that mean the participation that has been there has not been meaningful? And also, because I have told you we have this conversation so often, you'd think we have come to some change right now.
Yeah.
So yes, what has been happening, and what are you trying to introduce that is going to actually work?
First, we're not even trying to introduce, because these are policies that have been placed.
Yes.
It's just a matter of implementing. But first, I mean, the state of young people in this country is deplorable.
Yes.
Honestly, young people are not okay.
Yeah.
Despite the tremendous milestones that we've made
Yes.
to make sure that young people are at mind, young people are at heart, young people are not okay. Young people are experiencing worse times even ever than before. And, just to shed some light, and,
Yes.
Rita just mentioned of how we're constituting 75% of the population.
Of the population. You'd think we need a lot of help. That's a lot of people.
Let me
That is
tell you.
quarter the nation.
Now imagine if this number of population
Yes.
is affected and is not able to economically empower themselves, economically just support themselves, support their families. So what does that mean for us as a country? And I mean, as of July 2022, I mean, Kenya was rated third highest in matters teenage pregnancies.
Yes.
And 98 of young people, 98
Yes.
were getting infected weekly.
Yeah.
Weekly with
98.
HIV and AIDS.
AIDS.
Imagine.
Wow, these
98
are staggering
98 young
statistics.
people.
Yes. Per week.
Weekly we were getting these numbers.
Yes.
And I mean, this does not only just stop there, because then it means we're also getting a population that's also mentally ill.
Yes.
A population that's also affected by mental health. And poor diagnosis is not helping at all. And
Yes.
the lack of proper services is not also helping at all.
Yes.
So I mean, clearly young people are not okay, and we definitely need more interventions. We definitely need more resources pooled to just make sure that this population is put intact. And you mentioned about meaningful youth participation. This is a concept where young people are involved in the conversation.
Yes.
Young people are involved in the designing process,
Yes.
are involved in the implementing, and in also the monitoring. And it is just not involvement at all.
Yeah.
Because I might be sitting at a meeting, I will say something, and it ends there.
Yes.
I mean, so what is the impact of me sitting
Being
in that
in that
meeting?
meeting.
I mean,
True.
so you want to record that we had Emmanuel, a young person, in this meeting,
Yes.
but where does the buck stop? So I mean, meaningful youth engagement and participation is whereby yes, young people are involved.
Yes.
Yes, young people have a seat at the table, and they are not viewed as beneficiaries, even though they are,
Yes.
but leaders and partners
Yes.
in this conversation and in the designing process. So that by the end of the day, we are getting interventions, we are getting programs that are clearly centered for the youth and are made by the youth.
Yes.
So that the intake now is also natural, the intake is organic.
Yes.
Because right now what we are having, I won't lie, is some aged old guys
Yes.
who are trying to make interventions and programs for young people,
Yes.
thinking this is what they need.
Assuming that this is what they need.
Yet it is not the case.
Because I'm imagining, even if you're making these assumptions are of course based from their time when they were young people,
Yes.
which is probably not what is happening right now. So their hearts may be in the right place, but they are not helping as much.
Yeah, I mean, and to just show how we're changing really fast. I mean, the internet took about 2 years to get to around 100 million subscribers.
Yes.
Facebook took around 6 months
Yeah.
to get to 100 million subscribers. And you can also somehow, because it's not so far with Instagram,
Yes.
but guess how long it took TikTok to get to 100 million subscribers?
Yes. I'm guessing even shorter.
Yes, a month.
A month.
So if such a ripple effect
Yes.
can happen within a month, because I mean 100 million people are a lot of people.
Those are a lot of people.
So what is time, what are years, and what is our age then compared to that?
Yes.
Then it means change is happening and is happening rapidly.
Yes.
To also mean that the culture shifts are also happening so rapidly,
Yes.
in a manner that only those who are directly affected can comprehend.
Can be able.
Yes, and can be be able to just set up conversations and also processes that can be of help to them and their demographic.
Yes. Yeah. So the only way to really get in line or get ahead of everything that is changing, the demographics, the everything, it's if we ourselves, the young people, can get at the forefront of policy making, of being part and parcel of those conversations. And then Rita is back. Rita, I want you to take us through the national and international policies that exist as of now regarding adolescents and youth sexual reproductive health. What are some of the both international and national policies that are in place?
When I speak about the national policies, I want to speak about a landmark process that happened in 1994, where 179 governments came together and recognized that reproductive health is human right, and it is not just about population, but recognizing sexual reproductive health as a human right. Yes. And that is during the ICPD forum. That is one of the commitments that is international and Kenya has ratified. We also have the generation equality. We have the Maputo Protocol, among other commitments. And just to mention, in terms of the international commitments, we have the Constitution of Kenya, Article 43, that speaks about every person having the right to healthcare, including reproductive health. And it's important to also note that the Constitution does not discriminate who should access reproductive health. We also have Health Act that is an accompaniment of the Constitution that also speaks about, and it breaks up reproductive health mean issues of consent, among other issues. I'll speak about other guidelines. We have YFS guideline that is currently running. We have the AYSRHR policy that is in the pipeline being reviewed. We have the RH or reproductive health policy. So really we have a lot of policies that Kenya and other countries, Eastern African countries, have ratified. Yes. But again, I want to speak about the biggest challenge we have, and the biggest challenge that is contributing to the increased numbers of teenage pregnancies, even menstrual health issues. The other day you saw Honorable Gloria being shamed by parliamentarians. These are our leaders, shaming another leader who has power, being shamed because this person allegedly was going through her menstrual period. So imagine these other girls who don't have power, who are their community because I'm speaking about power because power is very important, even when you're talking about localization, because localization is about power. Those who have power and those who don't have power. And power can come in different ways. Power can come in terms of resources. Power can come in terms of privileges and the authorities we have. So the biggest challenge, we have these policies, but people who have power are able to enjoy healthcare rights than those who don't have power. And I have mentioned resources. I've mentioned different types of power. So in Kenyan context, we have the challenge of power, where there are people who are not able to access healthcare rights because of the biggest challenge that they don't have money to access healthcare rights. Go to informal settlements of Korogosho, go to informal settlements of Madare, where we don't have people who can even access healthcare insurance cover. Then it means that these inequalities in terms of healthcare access. So our conference is championing for localization, to say that we are localizing global commitments so that every person can access equal healthcare services.
Yes. Thank you. Just before we let you go, before I come back to Emmanuel, I wanted to know, Rita, are these national and international policies helping? One, are they right? Because before we go to implementation, we have to understand, are the policies actually right? Is what we are lacking just implementations, or these policies also are lacking? So are they lacking or not? And is what we need implementation or additional policies, or what exactly is going to be getting us on our way up?
I would say that the policies could be inadequate, but they also speak to healthcare.
Yeah.
But again, it's a progress back what we had in terms of access to healthcare, especially for women and girls. Access was very restricted. That is something we need to note. And there has been strides that have been made to ensure that access is there. It's important to note that healthcare, again, just like other issues, can be political. But again, we need to have conversation, meaningful conversation that speak to our values as African, but speaks to human rights and value and dialogues that are very meaningful to ensure that nobody dies because they're not able to access healthcare services.
Yes.
Or other people are able to access healthcare than other people. So I would say that the existing are not that comprehensive, but we've made strides in ensuring that that every person is able to access healthcare and other human rights privileges. Thank you.
Yes, so there are some policies that we are good, we need to implement as we even improve on them. Rita, your final remarks on the annual scientific conference that is this June. What would you like to see happen? You know, in an ideal situation, what would you like to see happen before we come back to Emmanuel in studio?
So what I would like to see happen is I would like to see co-creation.
Yes.
I would like to see co-ownership. I would like to see co-partnership. Conferences, again, we are speaking about localization and power. A lot of times young people don't even have the knowledge to be able to participate in these relevant forums. We have great young people who are doing amazing jobs. They are doing interventions on menstrual hygiene. They are doing interventions on teenage pregnancies, how to curb teenage pregnancies. Yeah. They are doing an intervention on gender-based violence. But these young people don't know how to pitch some of these projects. And because they don't know how to pitch or speak about this project, and they don't have access to relevant platforms where they can showcase their work, some of these interventions just get to die because, again, resources is also a challenge for young people.
Yes.
I am calling on young people for us to co-create some of these platforms and ensure that we are part of the conference and that we champion for meaningful youth engagement. But we are the change we want to see. It starts by yourself. Show up, submit an abstract, and be part of the process.
Yes. Well, thank you very much, Rita, for being here. For now, we want to let you go, move on to other things, but we hope to have you here because the conference is in June. Yeah. So that means we have some time. We hope to have you, Rita, in person as we continue with this conversation. Also, this is a conversation I feel cannot be done in one sitting. Yeah. So thank you, Rita. I want to come back to Emmanuel in studio, and thank you so much for joining us. You have truly shed light. I feel you are the simplicity of this conversation because otherwise it just seems like a lot of jargons. I like the way Emmanuel and Rita are bringing it to the ground, to the common mwananchi. So what is a kid in Korogosho thinking about this participation? So thank you very much, Rita. We are hoping to have you sometime in person soon. All right. We want to move on, Emmanuel, and we are talking about, Rita is talking about meaningful youth participation as well as localizing power. I want you to go back to localization of power because we had talked about, it's not just about having these young people in meetings, saying things and writing down minutes and nothing is done. So what does localization of power mean in this specific context?
I mean, let me just even start off by just lauding Rita.
Yes.
I mean, she has mentioned the policies, the international policies and the national policies that Kenya, is ratified under. And I mean, as you can hear, and also as the audience can bear witness, I mean, Kenya is tremendous in having policies. I mean, we do have policies back to back. Yeah. And they are great policies, especially the Maputo Protocol. I mean, it caters on matters reproductive health, on adolescent young women and women in general. Yes. So here we're talking about sexual and gender-based violence. We're talking about menstrual hygiene. We're also talking about child marriages, and we're also talking about teenage pregnancies. Yes. I mean, just by that policy in itself, if it is implemented
Yes.
effectively. I mean, right now,
Yeah.
because we're experiencing the triple threat,
Yes.
which is new HIV infections,
Yes.
which is SGBV, that is sexual, gender-based and violence,
Yes.
and also the teenage pregnancies. I mean, if that policy in itself
Just that one.
is effected,
Yes.
I mean, the numbers that we are currently experiencing
Yeah.
will definitely decrease.
Go down, yes.
Because I mean, teenage pregnancies, what it's telling us, it's young people are having unprotected sex.
Yes.
That is what a pregnancy means, unprotected sex.
True.
And if then it's teenagers who are having unprotected sex,
Yes.
then what does that mean? So now we bring it to the ground, right?
Exactly.
This means that young people are pre-exposed to the risks that come with unprotected sex. Here we're speaking of STIs,
Yes.
we're speaking of HIV, and I mean STIs can also not be very kind to you.
Yes.
Because something like gonorrhea or syphilis can run you mad.
Yes.
And if not in time catered for or addressed.
Yeah.
But let me now just come back to localization. I mean, yes, these policies are made on an international level.
Yes.
Right? And a country such as Kenya decides to place its commitment under that specific policy.
Yes.
So then the policy needs to be contextualized. And by this, we're meaning it needs now to read in the context of Kenya. It needs to read in the context of the problems that the people of Kenya are facing, be it economic, be it reproductive, whatever kind of policy.
Specifically.
Yes. So, and now the fact that we are even devolved, it even now means going further to get into the specific counties, the specific sub-counties and wards, to know what are the specific needs of the demographics and, for this instance, the reproductive health needs of the young people.
Yes.
And, Rita has mentioned Korogocho, because these are the places that most of the times are marginalized and young people are left alone, and we also have abandoned children and the orphaned children. So what does this mean for them? I mean, a young person, they're not economically right.
Yes, that's not
and they need to go to school.
Yes.
School is fees, because even in our public, and I want to put that in quotes, our public schools, there is some bit of money that is paid.
That is required.
So what if now this young person, and because there are many, cannot afford, because we've seen many young people, and these are teenagers, we're speaking about being sent home because of fees. Now they're in primary school, they need to look for fees. And remember, they're coming from a family that cannot support them economically. So it means that now they are now the providers. So it means they have to look for work. Now, we recently saw the expose about the tea farms. So now, let's now bring it down so that we can also get an understanding about the triple threat. So there's this young girl sent away from school. She wants to look for fees, for money, at least money for food for that evening. Now she has to look for work. So the coffee farm is a very right place, because it doesn't need any experiences, it doesn't need papers. So she goes and looks for that work. But now she's required to offer sexual favors for her to get the work. Now, mind you, this young person doesn't know anything about contraceptives, doesn't know about protection, but what is in her mind at the moment is food and school. How can I be able
to get?
Now, if honestly what is in your mind is food and school, I mean, is offering sexual favors without protection really a concern to you at that specific moment?
Not really.
So here we're speaking about the risk of the HIV infection. That is where it comes in. We're speaking of the risk of teenage pregnancies, because that is defilement. Before even we even go further. And what is defilement? This is sexual gender-based violence. So with this just one person, they have been affected by the whole thing.
Everything.
Yes. And I mean, so by the time they're coming to give birth, for the one who will choose to give birth, number one, accessing antenatal services.
Yes,
I mean, does she know the services? Does she know the facilities where to get?
Probably
and
not.
For the one who doesn't want to come or to get to term with this child,
yes,
and needs to get rid, I mean, getting rid is expensive.
Yes.
Does she have this money to get rid of this abortion, of this child that is growing in her?
Yeah.
The answer is no.
Probably
So
not.
what will she do?
Yes.
Quacks, backstreet, unsafe abortions.
Yes.
Then we end up with a dead young adolescent child who could have been very promising, maybe had a very promising future. And this is just one girl.
Exactly.
In Mathare or Korokocho.
Yes.
Now imagine the whole country.
No, we are talking about 75%.
Percent.
Probably I would as far as go to 90% of those people are in that situation that you are talking about. So we need to, by localize, we mean we need to contextualize, because we are very good at picking very amazing policies, but we need to bring them down to our level. We need to bring them down to who exactly is it affecting, how is it affecting them. Is this what the annual scientific conference is trying to do?
Well, the scientific conference brings together researchers, scholars, partners, stakeholders, in the reproductive health space, to just ideate and bring their learnings and experiences together and see how best, we can come up with solutions, and how best we can be able to solve, once and for all, this problem that we're facing. And the most important bit of it, or even the greatest bit of the conference, is the involvement of young people. We're speaking of co-creation, where young people are part of the planning.
Yes.
Young people are part of the committees. We're speaking of co-partnership, where also young people themselves, with the NGOs that Rita has mentioned. We have a lot of CBOs in Kenya, by the way.
Yes.
And most of them are youth-led. So partnerships where young people come in place and put in their skills, put in their efforts, and to just bring this conference together.
Yes.
So, yes, the conference is geared to making sure we alleviate the deplorable state that the young people are facing right now.
Yes.
And it's putting young people in the center of it.
At the center of it.
Yeah.
So if anything, this annual scientific conference just doesn't want to bring on board stakeholders money-wise, stakeholders education-wise, people with information. It just wants to bring this youth that they are talking about to be part and parcel of the conversation of the day.
And provide platforms.
And yes.
Because, right now, with the many CBOs that we have, that means there are many initiatives that are running in the country.
Yeah.
And most of them are innovative and highly innovative. And young people in Kenya, we recently had the young man who invented the gloves that can interpret sign language into audio.
Yes.
So for instance, the Reproductive Health Network conference provides a platform for such innovations.
Yes.
And young people can take opportunity by writing abstract of the innovations that they have created.
Exactly.
And so get an opportunity to come, present their work, present their experiences, and also offer learning. And because it could be one, it could be five, but imagine one intervention, one initiative that could create a ripple effect in the country.
Yes.
And the best way to do that is to have these young people come
on board.
Yes.
Because they're the ones with these ideas. They're the ones with the know-how of what health do we need.
And the new ways.
Yes, and the new ways that they can be able to invent. And one thing I like about our country is, apart from just new policies, we are very talented. This country, young people have amazing ideas.
Extremely.
You sit down and you're like, wow, where exactly, what were you thinking? Where were you seated when you were coming up with this? So we are not short of policies, and we are not short of young people with great ideas on how they can be able to be helped. All right, let's go on to recommendations. What do you provide as recommendations in improving the health outcomes of adolescents and the youth?
Among the barriers that we're facing,
yes,
the biggest chunk of it falls under awareness.
Yes.
We young people, and by young people I mean adolescents, the young people and the youth in general. We might think we know, but we don't know. And we're speaking of the Maputo Protocol. I mean, even from the audience, somebody just tell me what a Maputo Protocol is, and maybe even they've heard about Maputo Protocol today.
Yes.
So awareness.
Awareness is number one.
So increase awareness of reproductive health information of young people.
Yes.
And this can be done, by providing age-appropriate comprehensive sexuality education.
Yes.
And also, because also the MOH recently launched a website, a platform called lifeyangu.com, where young people can access reproductive health information, and young people from the ages 18 to 24. Number two.
So before you go, awareness is key, which is part of what we are doing now.
Yes.
Us having this conversation, us talking about Maputo, and us looking at people at giving information, basic information that you would think or you would assume people know. We are getting them to recognize, MOH now have a website, have somewhere we can go and access information. So awareness is number one. So accessing, because information is power. We start from there. Even before we go to implementation, information is power. And I hope that you guys at home are taking note, of these conversations. We are going to know where the conference is going to be taking place. We're also going to give you that information so that you can know where am I going to participate. Because if you don't know, then you can't participate in the first place. So awareness.
Before I even go to number two, it's very great point that you've mentioned there. What we are doing here now, and that speaks to the role of media. Either be print, either be radio, either be TV. I mean, media has the greatest role to play in making sure young people are informed, and also parents and caregivers. Because I mean, at the end of the day, they're going back home.
True.
They're going back to their parents. So media plays a big role in influencing perspectives, in influencing cultures. So if we have the media properly on board, and they're also covering factual, information about SRHR, then we'll be on a very great trajectory to achieving these great results that we ought to achieve. Then going to number two, and I've just mentioned it, is having young people lead and be partners. We don't want to be regarded as beneficiaries,
recipients.
Again, anymore. Right now, we want to be partners. We want to be leaders in these conversations, because then if the mantle is with us, ownership is easy. Because you cannot fight for what you don't believe in. You cannot fight for what you don't own. So yes, we involve young people and be intentional with the involvement. Number two is increasing the finances and support to the advocacy and communication efforts. I mean, yes, we can have all these measures. Awareness in itself, is financial. Awareness in itself is economical. So then this means the larger bit of it, in as much as we try to find innovative ways to just work around, it's getting the right finances, it's getting heavy finances to go into these interventions, to go into these programs, to equip young people with the skills, to equip young people to provide with young people with the platforms, so that they can meaningfully engage and participate, and also impact now their fellow demographic.
Thank you for that, because we talked about, before you go to the next point, we say this problem of this kid in Korogosho, number one, was school fees. If they had the school fees, we would not even have gone down the chain to the risk of HIV,
if she
to
was
the
not
triple
hungry.
threat. If she was not hungry, we would not have moved to her going to a coffee farm, So financial support, as much as we say, and I know we talk a lot about awareness and the youth opinions, but financial support is as great a factor as this. I mean, you took some transport to come here.
Imagine.
To give awareness, just talk. But there was transport, you had to dress up for this, you had to be prepared for this, and that requires financial support. So we cannot do this. We cannot do this without financial support. There are rooms you will need to get into, and you just can't even dress anyhowly.
Yeah.
You know, if you go
You
on
have
there,
to
you
look
are
the
going
part.
to this conference with slippers. No one is going to take you with a t-shirt. No one is going to even take your ideas seriously, no matter how brilliant they may be.
Yeah,
so financial support is definitely key.
Yeah.
We agree on that one. The
And
next one.
And I mean, I must say, or maybe believe, the most important of all is involve parents, involve religious leaders, involve caregivers, involve the community leaders themselves in these conversations. Because I mean, it is high time. It is high time we stop burying our heads in the sand.
Yes.
Wake up, smell the coffee burner.
Yes.
We need change, and we need it now. Because if we continue, it won't be great for us. Rita has spoken about inflation.
Yeah.
So now, if inflation goes up, then we also have a demographic that cannot empower themselves economically.
Yes.
Then we're up for doom.
Exactly.
So I mean, it's relatively high time that parents, community leaders, and religious leaders, because also young people spend time in churches.
Yeah.
They also now begin to having these conversations, and I mean candidly.
Yes.
Tusiguzie juju.
Yeah.
Yeah.
Usiguzie juju. Go
At all.
into the details.
Yeah.
Teach these young people how to make money. I don't know why religious places don't have these conversations. I mean, we're talking about everything else apart from how can you as a young person get empowered financially.
Yeah, I mean, don't just, inspire me. I mean, yes, inspire me and provide me,
Means.
with means and skills on how to now get whatever inspiring me to achieve.
Exactly. I'm yet to see conferences, or even you have brought up religious places that offer grants. You know, if we can have 10,000, and this 10,000 is going to a young person who will give us the most innovative idea on how they can be able to move forward. That person in the next 10 years, in the next 5 years even, they'll have transformed that 10,000 into a company, financial help, financial aid to be able to let these young people empower themselves rather. Yes, another recommendation?
Maybe the last.
Yeah.
And this is where also the buck stops.
Yes.
Implementation of these policies. And I mean effective implementation, not just implementation.
Yes.
Because young people, as we're speaking, a big number of them are currently holding the government accountable. Yes. I mean, Rita mentioned about the ICPD coalition.
Yes.
In Kenya, mind you, the ICPD Youth Coalition was established, and it was recently launched sometime last year. And it's a number of youth-led organizations, and by youth-led we mean it's young people who are leading organizations.
Yes.
That came together and decided, tumechoka.
Yeah.
It is high time that we also hold the government accountable to the ICPD commitments it made.
That they made.
And they developed tools, social accountability tools that they are now monitoring the government on. The annual reports that are coming out, what are they saying? Does it reflect
the promises that were made?
Or does it even reflect the actual work that has been done in the community?
Yes.
Or the results that are being showed in the community? So effectively implementing and also holding the government accountable.
Yes.
Yeah.
So we are not just putting out great policies, clapping, we are happy, we are going to do this. We need to put it into action, to actually implement, because we can sit here and we can talk all day, but nothing will change if we don't take this conversation outside kwa ground.
Yeah.
So we go and implement, we go and know, okay, so what exactly is affecting this kid in Kibra, and what can we be able to do specifically before they get too old, even before they get to their adolescence, they are 9, they are 10, before they get to their teens, what can we be able to do to keep these kids from going in the first place, getting themselves into GBV, or are not even getting themselves because they don't really get themselves, to being affected by GBV, contraction of HIV, STDs, STIs. What can we be able to do to stop it?
Yeah, and just to also add something on top.
Yeah.
I mean, Rita spoke about power.
Yeah.
So I mean, this also stems to the goodwill, because if it's policies, and I mean, about even mental health. The former President Uhuru Kenyatta enacted a mental health act when he was president. I mean, so you see, I mean, steps are being made, but now it's also the goodwill of those who are holding this decision-making seats. So that, I mean, let me speak directly to you. I mean, you are holding these positions. These are positions of high power, high influence, and a lot of young people are depending on your ability to just make sure that they are heard and whatever you're doing reaches down to them. So continue using your networks and your influence to spark up the goodwill that we need from the legislature to the executive, so that all young people can be impacted meaningfully and positively, and also just better, us as a country in general.
And I think this is where you see all the energy that I want to call them old people, for lack of a better word. That is where that energy can be focused into making sure the decision makers have been influenced in the right direction, that finances have been given to the right causes. That is how you can be able to help. Let these young people bring the ideas. Don't assume what they need. Don't assume what might help them. Ask them, and then follow through that chain to make sure that what they need has been given to them. I want us to wrap up and talk about the upcoming scientific conference. When will it be? Where will it be?
It is coming June. And before we even get there, I mean, there are 3 ways that young people can participate.
Thank you.
So you can register as a delegate. Slots are still open. The deadline will be on 15th May. So chap on that. And for those who have ideas, innovative ideas, who have been implementing for a long time, that CBO that you're running, those initiatives that you're running, write about them and deliver this abstract, to the RHNK conference. And the deadline for submitting these abstracts will be on 31st March. So it is fast approaching. So jump on their website. You will see a large banner over there, submit your abstract. So submit the abstract. And you can also look into organizations that are also offering scholarships, so that you can also get to attend physically to the conference itself. And if by any chance you don't get to be there physically, I mean, RHNK conference has you in mind, because it is hybrid, so to mean not even most, any update from the conference is shared online. So you can participate online, you can listen in to the dialogues, you can listen in to the conversations that are happening on the conference, and also get impacted and also get to share and get to learn. So those are the 3 ways that a young person can participate.
Where can one register as a delegate? Let's go.
The Reproductive Health Network website. So just search for RHNK conference. The first link that comes to you, just click on it, and it will guide you from the delegate to the abstracts, and to also how you can participate online. Everything is embedded on the website.
So wherever, from the comfort of your bed sitter, from where you TikTok,
Manze,
you can be able to now do something meaningful, participate meaningfully in these conversations. So they're on the June date.
We have the poster.
The poster is right there. So the conference is going to be going on as your poster is indicating right there. They have all the information, all the details. So you can be able to see all that information, all those details. And if you cannot be able to attend in person, you can be able to join in online, like Emmanuel is telling us. So this conference is going to be the 6th RHNK annual scientific conference on adolescents and youth of 2023. So of course, register now. You can be able to register from the 25th of January. Registration started on the 25th of January all the way to the 31st of March. So you can be able to register, and this is just for US dollars 200, okay, or 250. You early bird 200, so you get to save $50. That is amazing. If you will be late, $250, and this will be going down at the Diani Reef Beach Resort and Spa. This is at Diani Ukunda, Kwale County. if you can be able to join, kindly go ahead and do so. Diani Reef Resort and Spa in Ukunda, Diani. All right, you can go ahead and do exactly that. Any final words as we conclude? Anything that is important that you have not shared that you would like to share?
I mean, just a word. We've been told numerous times,
yes,
young people are the leaders of tomorrow.
Yes.
What I want to bring you to attention to,
yes,
tomorrow is today.
Yes.
Tomorrow is now.
Exactly.
So
tomorrow
to mean,
right now,
we are currently the leaders.
Yes.
Trust in young people. I mean, for me to be here, someone has trusted in
True.
me. An entire organization has trusted me to
yes,
represent them and to also work, around issues of young people. So
yes,
trust in the skills and capabilities of young people.
Yes.
Provide platforms and capacity build them where necessary, because it will come in handy to achieve in the long term,
yes,
this reproductive health progress that we want
yes,
to achieve.
So have faith in young people. I like the way that by our conclusion, we have found the spot for young people and we have found a spot for the older people.
Yeah.
The young people have this capacity, if only you can trust. Because I doubt if I had a younger and older member of the organization that you work for, I doubt they would have disseminated the information the way you have done. So someone needs to have faith in a young person to be able to communicate to his fellow young people. And in order for all of us now, you up there, push the policies, push on our ideas, let them be funded, let them be implemented. So there's a spot for everyone.
Yeah, because it is a partnership.
Yes.
Let's just make that clear.
Exactly.
It is a partnership because the adults have been here. They have seen how
yes,
the system works.
Exactly.
The young people are also here and they know what is currently working now, so they have new ways
yes,
of tackling that. So the adults can guide in how this is done and young people can provide the new ways. So it's a partnership
yes,
for both of them.
Yes.
And it's a leadership for both of them. So
yes,
there is room for everyone. No one is being left behind
yes,
by the end of the day.
There is room for everyone.
Yeah.
And I think that is my take home, that everyone can be able to participate and in a helpful manner be able to participate in this conversation.
Yeah.
Thank you very much, Emmanuel. It's been an honor, a pleasure to have you. I'm hoping that you will come back here because I feel that's a lengthy conversation that we can be able to have from all the way from GBV to HIV and AIDS to STIs to early pregnancies to unsafe abortions. There is really a lot that we could sit here and talk about and create awareness, because like you have said, that is our role as media, to create awareness, to let people know where are these organizations, where can they be able to register, how can they be able to form CBOs on these specific issues and be able to help out.
Yeah.
So is there anything that we have left unsaid?
Shukran sana for the platform.
You're welcome.
I mean, if also you want to interact with CSA Kenya,
yes,
you can
social media
follow us at CSA Kenya, that is on Twitter. We're also very active on Instagram, which is also at CSA Kenya, and Center for the Study of Adolescence on Facebook. We have amazing content, amazing opportunities that come up from time to time. And we believe in young people. So just be on the lookout. In case you see something, just throw in, and we'll definitely be there to help you where we can.
Yes, your next opportunity might be lying with CSA Kenya. So go follow them on their social media handles. Let's also create some, make some noise for CSA Kenya, because the louder we are, the higher our chances of being listened to are. So go follow, go like their work, go comment on issues that they put out there, go be part of the conversation. We are done. Ivy Maven Jr. is saying powerful conversations, I believe, and they're gaining from this experience. So thank you very much, Ivy, for joining this conversation. We are going to be getting to the rest of the feedback after we are done with the next break that is coming up. But right about now, we are done with our launch number 1. Emmanuel, thank you very much for being part and parcel of this conversation and for coming here in the first place, for
thank you
getting your time, using your time to be here. We are truly grateful. When we get back, ladies and gentlemen, we are going back to our Duos Festival performances and enjoying some show, because we are here to learn as well as have fun while